introducing our guest of honor and speaker is a great privilege. The RMC welcomed Dr. Walsh in early spring of 2019. Dr. Walsh and his family moved to Mount Pleasant and launched the Advanced Urology Institute of Atlantis. Dr. Walsh completed his residency in urology at UT Southwestern in Dallas. He trained at 5 major hospitals, including Portland Memorial Hospital, Baylor Medical Center, and Children's Medical Center of Dallas. He completed an internship in general surgery at UT Southwestern affiliated hospital. And now Dr. Walsh has returned to Texas after practicing in California for 11 years. Dr. Walsh and his expert staff are an asset to his community, and it is a pleasure to welcome him back to his home state of Texas. Please help me welcome dear friend and colleague, Dr. Walsh.
Overview, I'm going to talk about treatments for BPH, which is benign prostatic hypertrophy, or an enlarged prostate. Specific treatments that I offer are the HoLEP laser enucleation of the prostate, or HoLEP, and Urolift. I'm a center of excellence for both procedures, and I train other urologists both nationally and internationally. So, overview of BPH. On the left side, you can see a normal bladder and prostate. On the right side, what happens when the prostate enlarges and constricts the urethra is that the bladder has to work harder, and when it works harder, it gets larger, and when it gets larger, it gets irritated. So men ultimately develop symptoms of frequency and urgency and deep urine stream. And the problem is, once bladder changes take effect, you can't really reverse the bladder. So the idea is to intervene early and to prevent bladder dysfunction. This slide shows the progression of BPH over time. On the top, you can see the enlargement of benign prostate tissue. As it gets enlarged, it squeezes off the urethra, and you can see that on the bottom images. For instance, it's faint, but the two prostate lobes are coming together, almost completely blocking off the urethra. So, how do you know you have a problem? Well, it's important to recognize the symptoms. So, if it bothers you to get up at night multiple times, or on the ride to Dallas, if you can't hold it until you get to Dallas and you got to pull off the side of the road, or if you're playing around the golf and you can't get through it, you may have a problem. So the treatment options for BPH historically are medications like Flomax. Most likely, if you're over 50, you're on this medication. It's a very common problem. The problem with medication is that it's not very effective, and there could be side effects. And ultimately, medication really doesn't prevent progression to bladder dysfunction. Hence, the need for other treatments like surgery, or a newer one that's been around since 2013 called the Urolift. The Urolift is an office-based procedure for BPH. It takes about 10 minutes to do it. It's done under a local anesthetic. It doesn't require any general anesthesia. It involves placement of a scope in the urethra. The prostate is compressed, and then a series of sutures with little anchors are placed to hold them in a compressed state. Most people have heard of a TURP, which is a traditional surgical procedure called transurethral resection of the prostate. And it involves going to the operating room, placing a scope in through the urethra, and then removing parts of tissue until most of it's removed. That's been around for about 40 years. I've been trained to do the HoLEP laser enucleation of the prostate, which involves going to the operating room and putting a scope through the urethra and actually shelling out the prostate like one would remove an orange from the rind instead of just taking little bits and pieces of tissue. So by enucleating the prostate and pushing it into the bladder and then removing it with the morcellator, we can get more tissue per unit time with less blood loss and a quicker return to function, and there's really no size limit. The next thing I want to talk about are stones. Sweat a lot and don't drink a lot of water. Titus has invested in a laser called the luminous Moses laser, and it has a lot more functionality than traditional lasers have. Ultimately, bottom line is with this particular laser, you can treat stones in about 50% of the amount of time that a traditional laser does, and it's more likely to completely treat the stone at one session. The most common procedure we do is a ureteroscopy, where we use a lighted instrument to go in through the urethra and up the ureter and use a laser fiber to break up the stone. So, I don't know if you can see this very well, but this is an example of how the laser does it. It fires on the stone and basically dusts the stone into little fragments like sand. So the other part that I'd like to introduce is the Moses, which is, bladder cancer is a cancer of the lining of the urinary tract. One of the signs of bladder cancer could be blood in the urine. So if you have or develop blood in the urine, that may be a problem that you need to come in and see me.
But I'm Terry Scott, I'm the CEO of Titus Regional. We want to thank you for letting us come to Mount Vernon tonight, come to your county. Me and my wife are frequent here, so we appreciate coming tonight and just getting to meet you. We wanted to bring Dr. Walsh. The best part of Dr. Walsh is in the back. It's a Laura. This region was blessed with two great urologists. We had Dr. Stewart and Dr. Watkins here for several years. When they left several years ago, it took us quite a bit to find the right person. That's amazing thing. To find the right person to come in to this area. Titus Regional supports Titus County, but also the 4 counties that surround us, the west side of Bowie and the west side of Cass. We serve about 100,000 people. So it was critical for us to find a urologist who can meet the needs of those 100,000 people. I've seen the stones that were described on the screen, some of the most manly men in Northeast Texas that I've seen. I've seen them on their knees in our emergency room because of their stones. And so it's critical for us to get a urologist here who can do things. Dr. Stewart has been working with Dr. Walsh, and this last week, while Dr. Walsh was on vacation, got to use the new equipment. It was blown away. The accuracy and just the opportunity that the new equipment brings to this area is phenomenal. We couldn't do that without somebody of Dr. Walsh's skill. So we're glad to have him part of Titus Regional and Northeast Texas. I can't come to Mount Vernon and not thank our gracious host, Dr. Litho and his beautiful wife. This community is blessed to have this couple in the community. I've had the opportunity over the last 7 years to work closely with their family, and we've enjoyed working with them, working with Mount Vernon, working with Franklin County. In Titus right now, we are a primary stroke center. We have some of the best stroke times in Texas. If you have a stroke, the best place to have a stroke is Northeast Texas. We partner, get sick local is my routine. So, but we work closely with Dr. Litho and his team. We also have a phenomenal cath lab. I will tell you, there's a 59-year-old man in Talco who was saved because of our investment in cardiology and our cath lab. Last week he was in 63 minutes from the time the ambulance got to Talco. He had already coded on the table at Titus. The cath opened up his heart and they brought him back to life. And because we have that technology here, we were able to save his life. He would not have made it to Dallas. He would not have made it to Tyler. So what we're doing in Northeast Texas is for all of us. So we appreciate your support. Tonight's dinner is supposed to be fun. There's nothing more fun than looking at kidney stones. But we're going to leave that joke there because there's so many places they can go and get in trouble. If you want to come to the table, me and my wife and drink some wine, we'll tell jokes about that later. But the last thing I want to do before dinner is served is on September 14th at the Mount Pleasant Civic Center, we're going to have our annual gala. We'd like to invite you to come. Seth has information about sponsorships. The proceeds this year will go to the 5th floor, which is our orthopedic floor. And she said, thank God. The 5th floor of our hospital is the last part of the hospital that has carpet, and it needs a nice refresher and new nursing stations. Over the past couple of years, the gala has funded our new 5,000 square foot surgery waiting area, which Dr. Walsh's patients love, and Courtney says it's beautiful. And over the next few weeks, we'll be renovating from last year's gala the 2nd floor. We deliver 1,000 babies a year at Titus Regional. The 2nd floor, the women's birthing rooms, you've never been in them, are beautiful. It's a great place to have a baby. The rest of the 2nd floor is 1975. Not that was a bad year, no offense to anybody, but it's time to get rid of the carpet and some of the paint. So the proceeds from last year will do it. So we'd like to invite you out. We have a day Whiteman Band, and it's a good party that night. So they're fun. Come dance with Courtney that night. It doesn't cost. Again, tonight's about enjoying your friends, meeting new ones. But we're going to go ahead and turn it over to the chef and let him serve dinner. We'll come back at the end and thank you one more time. But again, welcome tonight. Drink, enjoy, and talk about kidney stones.